Morning. Today we are with Miss Yulene Koch. She is a public health specialist with a strong knowledge of infectious diseases, of TB and HIV. She has over 20 years experience and technical ability at national, provincial, and primary healthcare level and community level. She has worked at all levels of health system in South Africa and has collaborated with partners in designing, implementing, and evaluating health programs. She is patient-centered and an advocate for improved management and system development for patient care. Ms. Koch is currently occupying the Deputy Director's post of drug-resistant TB and HIV at National Department of Health since 2017. She is actively involved in support and clinical management of drug-resistant TB programs in the 9 provinces, monitoring, reporting, and conducting impact assessments, providing training, supervision, and support to provinces and subdirectorate supervision. Welcome, Ms. Koch.
Good morning. Thank you so much for inviting me.
Since today we are going to be talking about drug-resistant TB, I think we're going to first of all start with what has South Africa made with regards to the gains that we have made in South Africa regarding drug-resistant TB.
Okay, thank you. So since 2010 to 2011, we have implemented the GeneXpert cartridge. And what the cartridge in essence enabled us to do was receive a drug-resistant TB results for a rifampicin-resistant TB within 24 to 48 hours. Now that is a major stride for us. Previously, we had to rely on our culture results, which could take up to 6 weeks. But just imagine now having the results within 24 to 48 hours. In addition to that, we've also started decentralizing our drug-resistant TB services in 2011, which means we ensured that we had a drug-resistant TB facility within each and every district. We've accomplished that. And since we accomplished that, we decided to further decentralize and ensure that we have at least one initiation site for drug-resistant TB in every sub-district. To date, we have achieved that result by 94%. This is to ensure that we bring the services closer to the patients and the patients don't have to travel that far, looking at a patient-centered approach. In addition to that, in March 2013 to March 2015, we started with the bedaquiline clinical access program. Now, if we look back at the drug-resistant TB program, we have never had new drugs within the program since I can remember. But in 2013, we started with a new drug called bedaquiline. So the clinical access program was done in certain provinces at certain sites. And by 2015, the 24th of March, which in essence is World TB Day, we started scaling up the bedaquiline drug, which meant that our patients that had severe adverse events, they had options now. We could actually substitute the drugs with bedaquiline. And then in 2017, the WHO announced the usage of the short regimen, which was looked upon from the Bangladesh trials. However, in the Bangladesh trial, they still use the injectable agent. Now, we all know the injectable agent was not a very user-friendly drug. Our patients had to receive this injectable agents for 6 months. And the worst part of it all, it caused our patients to go deaf. But we didn't have any other options. So what were we left to do? instead of just using and continuing the shorter regimen with the injectable agent, South Africa decided in July 2018 to get rid of that injectable agent completely, and we replaced it with the bedaquiline agent, and our success rate was so much better. So remember, we do not face in new approaches without adequate research being done. So in 2018, we started the scale up of an all oral shorter regimen. And from there onwards, with our results and our outcomes, WHO also decided to get rid of the injectable agent completely and started following suit with the South Africa regimen of an all oral regimen for the 9 to 11 months of the patient's treatment.
Thank you very much, Yulin. I mean, that was really, really informative. It just goes to show how far we have come with the management of drug-resistant TB in South Africa. But I mean, we all know we've gone through a phase where COVID pandemic has really, really hit each and every one of us. And I'm sure it has also affected the drug-resistant TB program. Can you just give us highlights of how this affected your program?
Yes, for sure. We did immense gains with the drug-resistant TB program, as you mentioned. However, when the pandemic started, our TB program regressed. It was associated with the COVID pandemic, and during the pandemic, it was advised that people would only seek health assistance if it's an emergency, which means that our patients did not actually go for assessments. So during the lockdown periods, we had really had negative impact on our program. Our during 2019 and 2020, during the lockdown period and the pandemic, the number of TB tests that was done by the labs, it decreased by 23% from the normal TB tests that we normally conduct. And in addition to that, the number of patients that tested positive decreased by 25%. Now we're asking ourselves, what happened to our patients? Where are our people? And that is what we are constantly worried about.
Seriously worrying. But what mitigation steps were taken or are taken post this COVID-19 pandemic? Because clearly something has got to be done. Where are those patients?
Correct. So what we started or what we developed was South Africa works on a TB recovery plan. So we seek the expertise from various partners, civil society. Everybody was involved in working towards this TB recovery plan because, as you mentioned, where are our patients? We need to recover our gains that we made pre-COVID. And the aim of this recovery plan was, in essence, then to reverse the losses that incurred during the COVID pandemic. The key objectives of the recovery plan was to find the people that are undiagnosed out there in our community. Where are they, as you mentioned? We also needed to strengthen the linkage to care once we have diagnosed our patients. And then, in essence, also strengthen the retention in care. So once we found the patients and we've diagnosed them, we need to ensure that we retain them in care so that they in actual fact complete their treatment. And last but not least, one of our key objectives was to strengthen TB prevention efforts. How are we going to prevent TB in future?
Very interesting. Any future plans for the drug-resistant TB program? I mean, I'm sure after everything that we have gone through, the losses during the loss of patients during not necessarily losing them as in they disappeared, but where are they? During the COVID pandemic, the losses that were experienced within the program, your future plans, what are future plans that we have and what can we look forward to within the drug-resistant TB program?
I'm sure you can see my big smile on my face. I'm very excited for the future. We have been working towards implementing an even shorter DRTB regimen. So previously, our short regimen was from 9 to 11 months. That was the duration our patients had to take their treatment. Unfortunately, it was still a lot of drugs they had to take. So the short regimen consists of 7 drugs, different drugs that the patient has to take. So now what we are busy working towards, and we're hoping to implement it by the 1st of January or early next year, is an even shorter regimen of 6 months. The duration for this regimen will only be 6 months. In addition to that, it will consist of 3 to 4 drugs only. So that will make our patient's journey so much easier. I mean, who wouldn't want a shorter duration of treatment? Who wouldn't want to take less drugs? We normally struggle just to complete an antibiotic, and here we are giving our patients such a lot of different antibiotics for such a long period. So we're working towards this, and we're hoping to cure way more patients, because our biggest challenge that we've got in our TB program is our patients become lost to follow up. And the causes of that is they become pill fatigue. They are tired of taking all these drugs, and the duration is so long, and they feel so much better. So research has shown us that we can reach success with an even shorter uh, shorter period of treatment with fewer drugs. In addition to that, we are also looking at implementing the XR-TB cartridge, which we're also hoping to start within the next 2 months. Hopefully by the end of November, December, we are hoping to start with the XR cartridge. This means that the patient would have the XR TB results within 7 days. Now, isn't that amazing? Previously, we had to wait for such a long period to get our results, but now the duration of this is even shorter. So yes, we are very excited. We are moving forward. We are trying our utmost to make the patient's journey more tolerable and easier for them to in actual fact complete the journey. And we are there to support them. At the end of the day, we are very focused and we are very patient-centered. We are wanting our patients to have a complete healing and good journey whilst on TB treatment. TB is curable. We don't need to lose any patients to TB in today's day and age, especially with our good drugs that we've got.
Thank you very much, Ms. Koch. From our conversation, I think the take-home message would be TB is curable, even if it is drug-resistant TB. And there are exciting new developments that we are going to be having starting from early next year, which are going to make life for patients a bit easier and make sure that they are able to adhere to their medication a bit easier. Did I sum it up properly, Ms. Koch?
That is correct. Patient-centered approach. Our patient on top, and we are trying our utmost to ensure that they complete the treatment. TB is definitely curable.
Thank you very much for that information that we had. It was a nice short session, but the most important thing is TB is curable. Thank you very much for your time today.
It's such a pleasure. Thank you so much.
Thanks. Bye.
Bye.